Noon. Thank you so much for coming to this very, very exciting occasion. We are very honored today to have with us Dr. and Mrs. Pappas, and I am here to introduce to you Dr. James Burge, the president of Franklin Pierce University.
Thank you, Lisa. Let me add my welcome as well. We're delighted to have you all here. I'm grateful to Dr. and Mrs. Pappas for not only their support, but for being here today. To the members of the Board of Trustees who are here, our colleagues, our alumni, and our students. Just about 1 year ago, we broke ground on a new facility which would become the Pappas Center. Since that time, the center has already made a lasting impression on our students and our staff. By providing more science space on campus, we were able to accommodate an increased number of students interested in the health sciences major. And in fact, more than a year ago when we envisioned this facility, we projected that we would attract 30 new health science majors. This fall, we had 105 students check into campus. Additionally, because we increased our athletic training space tenfold, our student athletes are performing better and they are experiencing fewer serious injuries. This facility, our increased enrollment, and our expanded academic and athletic programs would not have been possible without the support of our friends Arthur and Martha Pappas, for which we are sincerely grateful. Before we officially open the Pappas Center with the ribbon cutting, please join me in welcoming Dr. and Mrs. Pappas and hearing what Dr. Pappas has to say.
Thank you very much. It's a great pleasure for both of us to be here today. Our affiliation with the Franklin Pierce facility dates back just about 20 years. We have a home in Jaffrey, and little did we know that'll become a pivot to our spending time here. Your athletic trainer, good friend Cindy, referred a patient to me when I was still in active clinical practice. It was a soccer player who had a recurrent ankle injury and was having his career somewhat modified. Fortunately, we were able to improve his status, and he returned to playing soccer, and it was the start of a great relationship with Franklin Pierce. I had the opportunity to treat a number of patients following that, and I've always been impressed by the commitment that Franklin Pierce has to its athletic and academic programs. Dealing with your athletic director and your athletic trainer have proven to be personally rewarding, that people of such character and ability, commitment to their students exists. It was on this basis that we had a meeting just 2 years ago now with the past president of Franklin Pierce, the current president, the athletic director, and the medical director. It was recommended at that time that they would be improved if they could expand their athletic training space. And that was the start of the whole discussion. We want to improve the athletic training space from basically a large closet to a current facility. Following that discussion, Martha and I felt that, well, it's important for the athletes to have best care, quality care, but it also has to spread out to the student body so they appreciate the importance of quality sports medicine, athletic care, and health resources. As people graduate, there's very little for them to continue with their their education in the way of health issues, and felt that that was important to develop a health sciences component to the educational program. Personally, I was in a situation similar to that, graduating from high school, not knowing what I really wanted to do, and had plans for going on to education and graduate education. Following my career in college, I was fortunate enough to become enrolled in medical school and go on through various training programs. But I realized in retrospect that I hadn't had a chance to think about the importance of these different aspects of education and lifestyle. Following a reflection on my own experiences, the importance of quality education and quality medical care, I think we have both become very much committed to supporting both those aspects of life after graduating from high school. The importance of medical education and knowledge of health sciences is critically important, particularly for someone who does not consider that as an opportunity for their future growth and development. Following a career in college, where I had the good fortune of participating in athletics as well, I proceeded on to medical school and on to the field of sports medicine, which is really a subset of medicine healthcare, but a very important one to people who have been particularly involved in athletics over the years. During that time, I had the opportunity to meet many athletes, treat many athletes, and appreciate the importance of quality treatment education for them. And thus, when the opportunity came to discuss improved sports medicine at Franklin Pierce, Martha and I both felt it was important to add the educational component for availability to all the student body. This is not like many other schools where 50%, 60% of the athletes graduate. The education is found to be equally important, and the procedure to consider their lifestyle very important. Thus, when you graduate and consider the opportunities that are available to you, it's important to realize how important the health issues become, not just for individual injuries, but for overall community care. Be a member of a community, be a component in the medical health issues, whether it be the acute trauma team, the opportunity to participate in the heart attack team, or many other opportunities that should be part of your life, but most of us have not had the chance to consider those part of life until we're confronted with the reality of personal medical disaster, or a family problem, or a community that requires more attention and direction for health care. Thus, when Franklin Pierce provided the opportunity to enhance the quality of medical care, we also suggested the opportunity to expand the health sciences program and not just think about someone who's going to come here and be a member of our baseball team or basketball team, whatever, that there's some basis for your educational component and the reason you're here. And that's why we both feel it's so important that the combination of sports issues and academic issues are critical in considering the educational college of your choice. To include this, we felt it was important that there be a link between the campus and Ringe and some of the graduate educational components. The physician assistant program, physical therapy program, the administrative MBA program, are all important factors that should have been linked in an overall pattern, and that's what we hope that would become the mode with this new building that has happened in the last year. The understanding of the health sciences goes beyond just knowing the anatomy or the biology. It's how the health sciences impact the individual as well as the family and the social group. And those are the high points that we hope will be encouraged and emphasized in our new building being discussed today. So we want to thank you for the opportunity to be here, to become part of the Pierce community, and hope that our contribution will be the start of more to come. It's a great opportunity for all of us. Thank you.
Thank you, Dr. Pappas.